Let's Get Real really started for us when our mental health nurse director came to us and basically engaged us in the Let's Get Real, what it meant, what it was about and how we could use it to enhance our service delivery. So we then completed a gap analysis, and that gap analysis basically informed what gaps we did have and where we could utilise the Let's Get Real resources to fill in those gaps. So following on from that, of the group of people who made up our workforce strategy group, basically we divided up the work. So looking at the 7 real skills as well as looking at the enablers. So I guess, for example, our consumer advisor, he looked at reviewing the documents, the modules around working with consumers, as well as stigma and discrimination. One of our staff within that group, who is our Maori unit manager, he looked at working with Maori. Another example would be 2 of our professional advisors within that group, one who represents occupational therapy and the other representing social work. They looked at the HR tool. We had a stigma and discrimination workshop, which wasn't mandatory, but it's certainly the tool allowed us to emphasise that we wanted to make it mandatory. For example, the law policy and practice, Let's Get Real tool, the vignettes in there about advanced directives for our services was really, really important. And the other tool in particular that we focused on as well was working with families. We have an Involving Families workshop, and we've used the vignettes from the practitioner level of Let's Get Real working with families tool to actually enhance the training that we currently deliver. I think the differences that we're starting to see and things that are starting to emerge really within our services are our staff are much more consciously aware of working in collaboration with their clients, and I think what's shifted is staff in the past have thought they were working in a collaborative way, but in actual fact there's a lot more that is now being done in collaboration with their clients. We're also hearing a lot more about family meetings taking place, particularly in the inpatient services. In an acute setting, wards are really busy, doctors aren't always available, but in actual fact every opportunity that staff can to involve families in meetings, reviews, discharges, they're doing that more and more, and we definitely have seen a huge change in the last couple of years, and I really think that Let's Get Real, Involving Families, the team planning tool, has certainly assisted in that process. I think what's been really good about the learning modules is they come in 3 levels, essential, practitioner and leadership. We've done quite a lot of work with our new graduate nurses, really just so that they have become aware of Let's Get Real and what it means and what it's going to mean to their practice. So when we look at the essential module, they know exactly what the expectations are of them as novice practitioners. And then again, the practitioner level allows our staff to know exactly what's expected of them, and at the leadership level then we can get that buy-in from our leaders and our managers and the people who make decisions as well. So they've been really easy to use in that regard. I think what Let's Get Real is doing, and will continue to do for nurses, is basically to allow nurses to actually reflect on the work that they do, reflect on good practice and maybe on practice that isn't as good as it could be, and to think about the culture of the organisation that they actually work in. Let's Get Real has allowed nurses to see there's real value in the work that they do, and the work that they do, working with families, working with communities, all of those things. And so I think for nurses, if we can see the value of the work that we do, then we value ourselves more, and therefore our attitude towards our work has got to enhance. The really good thing about Let's Get Real is this is applicable to everyone, and I think it's really good for all of us to reflect on our practice, to see ourselves as being inclusive of our clients and of our families. And sometimes maybe some particular professions are better at that than other professions, but it's all of our responsibility to be inclusive and to work with our clients and, you know, deliver a service, the best service that we can possibly deliver. Let's Get Real is all about consistency. So no matter where someone goes, they will meet the same good values and attitudes from the staff that are going to be delivering that care. So really important that the whole of the sector gets on board. So I guess my advice to other organisations that are maybe just starting out with the Let's Get Real is to look at what their own organisation is, what it is they want to be delivering, maybe conduct a gap analysis as well, and then you know, maybe just look at some of the resources that they could start using immediately and then gradually work towards the utilisation of the additional resources. As an educator, the resources that TUPO have made available has made my job so much easier.